called serum, HCG, or you can have it just through your urine. When you go and buy a pregnancy test, that's what you're checking. You're checking for HCG in your urine. Okay? So, back to subject. So, when I've been on Clomid, so I have several follicles. I work in an infertility clinic, but they're kind of cheap. So individually, you have to go from your previous exam. And if you did the first exam, everybody that takes the exam after you has to follow you. You have to keep 1, 1, 2, 2, 3, 3, 4, 4. You have to follow through. That's how come they usually, when you take call a week at a time, or sometimes a month at a time, because they want the same person doing the exams on these routine meetings. Okay? Now, if you work in a state-of-the-art center, this machine automatically measures each follicle and numbers it. What does that help us do? It's going to cut down the exam by a lot, and it's going to help our ergonomics. Okay?
Do radiologists like that?
I have no idea. I've never seen one. I would. It's less work, you know. Because when I scan, I always wore like clogs, and this is how I scanned. Now I have bad knees. Because I scanned like this. That was before ergonomics was even in the dictionary. But now we teach you how to protect yourself. Okay? But I don't have problems with my arms or my shoulders. So, okay. So this is just the diameter. If you have a normal cycle, your diameter of your follicles is going to be 1.5 to 2.5. Here at Harris Health, if you have a follicle that measures 25 millimeters or 2.5 centimeters, then they're going to follow up with that because they consider that a cyst. Okay? So whatever facility you get a job at, whenever you're done, they're going to give you the criteria that you're going to be following. Hopefully you won't work for a place where you have 15 doctors and they all have their own criteria. That happens too. Okay? IUDs. The only way to prevent pregnancy is not to have sex. Abstinence. That's the only way. IUDs aren't 100%. Birth control pills aren't 100%. Condoms aren't 100%. Some of the contraceptive devices have been outlawed. Okay? Now, the two that are used here, they're both T-shaped, and one of them is the Marina, and it's copper surrounded by another thing, and they think the copper is an expellant for the sperm. Okay, because it puts out. Well, y'all all bitten on a copper penny, right? Okay, so that's that. Think of that being on the inside of you. But the Marina also puts out hormones, and I think I read that the hormones keeps the mucus too thick that the sperm can't travel. Okay? There's another one, but I can't remember what it is. There's also another one, I think there's a picture of it here.
Paragard?
Yeah, it could be. These are some of the old ones that we have seen. I've never seen any of these. Well, I've seen all of these, but this. I've never seen the Dalcon shield. Can you imagine them putting this thing in there? These spring down, It springs down, they insert it, and then it opens up. This, I don't know if I'd want that to go up my cervix. Or even this. You know, the lippy sleep, but I've seen this before. But we're such a diverse community. You're going to see a lot more than what's used in the United States because they come here with their own birth control. Okay?
Do you have any side effects for this?
Side effects, yes. They can, your string can break, okay? And you don't know if it's in there or not. Ultrasound is the imaging modality because they don't, if you're pregnant, they don't want to expose the embryo to radiation. Okay? Bacteria can travel up the string.
UTI.
And then you have what?
UTI.
PID. Okay? It can perforate the uterus. They can, when they put it in there too far and it can perforate the uterus. I've seen them out in the peritoneum. They've traveled all the way through the endometrium, myometrium, and perimetrium. Okay? Because they can perforate. What else? Or they can fall out. So if you don't find your string, your first thought is that they're not there. But sometimes the string breaks. Okay?
So, we're supposed to check on the string?
Once a month, you're supposed to check the spring. The
They told
string.
me not to worry about
They told you not to worry
it.
about
Because
it?
the women that do check on the string, they end up pulling it. They tell me
Oh.
don't even worry about it. Like, they'll be checking on it.
That they'll check you. So, okay. That's
Plus,
good.
I'm in the lab now.
Yeah. This is a Chinese ring. They also have vaginal cuffs. They're kind of like a diaphragm where you put it up on the inside of you, but you have, it's called the Nuvaring, and you put it around the mouth of the cervix. Okay, you just can't put it in there. You've got to make sure that you're all the way to the cervix and make sure it's around that muscle. Never seen one of these. Okay, these are what they're going to look like on ultrasound. They're going to be hyperechoic. Sometimes you'll have acoustic shadowing. Sometimes you'll have here's acoustic shadowing here because it is hitting just perfect. Now, if I want to look at the endometrium, I'm going to have to go to the side of the IUD on both sides. And I'm going to say right endometrium and left endometrium. Okay, because I've got to tell the doctor where I'm at if there's an IUD. Okay? This is called Escher. It's only been around for a couple of years and they've already outlawed it. These are implants that they put into the cornua of the uterus at the interstitial area, but they tend to travel, so they've outlawed them already. And these also put out hormones, so there was no implantation. Okay? Couldn't be.